If you're taking losartan, amlodipine, valsartan, or metoprolol, you've likely been told the name of your medication, the dose you should take, and maybe when to swallow it. But here's what often gets left out of that conversation, the part that actually determines whether you stay safe on these drugs. That missing information is where people get hurt. They faint getting out of bed at night, they stop their medication too quickly and end up in the emergency room with chest pain. They notice their ankles swelling and dismiss it as just getting older, or they panic over a symptom that was never properly explained to them in the first place. I'm Dr. William, and if one of these medications is sitting in your daily pill organizer, you need to stay with me because by the time we're finished here, you're going to understand the critical truths about these drugs that can protect your heart, your kidneys, your brain, and in some cases your life. Before we dive into the details, let me be clear about something important. When I talk about what doctors often don't explain about these medications, I'm not suggesting your doctor is intentionally hiding information from you. The reality is that most appointments are rushed, explanations get compressed into 30 seconds, and the details that matter most when you're at home, the details that actually keep you safe, those are often the details patients never get to hear. These 4 medications are incredibly common. Millions of people take them every single day. But common doesn't mean simple, and it certainly doesn't mean these drugs work the same way or that one can just be swapped for another without consequences. Each of these 4 medicines lowers your blood pressure through a completely different mechanism. Losartan and valsartan work by blocking a hormone system that tightens your blood vessels. Amlodipine relaxes those vessels through an entirely different pathway by blocking calcium channels. Metoprolol takes a different approach altogether. It slows your heart rate and reduces how hard your heart has to work. They're all trying to achieve the goal of lower blood pressure, but they're taking completely different roads to get there. The most dangerous mistake people make is assuming these drugs are basically interchangeable, basically harmless, and basically fine as long as the number on your blood pressure monitor improves. That assumption is exactly where people run into serious trouble. Think about Leonard, a 72-year-old retired electrician who told me he'd taken 3 different blood pressure medications over the past decade, and honestly, they all felt the same to him. He meant well, but that one statement told me he didn't truly understand his own treatment at all. If you don't know which medication family you're taking and how it works, you can completely misinterpret every side effect, every symptom, and every change your doctor makes to your prescription. That difference matters because the medicine your doctor chose often tells a story about what your body specifically needs. If you're on losartan or valsartan, your doctor may be thinking not just about your blood pressure numbers, but also about protecting your kidneys, reducing your risk of heart failure, or providing long-term protection to your blood vessels. If you're on amlodipine, they may want the strong, steady blood vessel relaxation that this medication provides, especially if other medicines haven't been enough. If you're on metoprolol, the reason may not even be primarily about blood pressure at all. It could be about controlling your heart rate, managing angina, recovering from a heart attack, treating heart failure, or stabilizing an irregular heartbeat. Understanding that distinction changes everything about how you interpret what's happening in your body. Here's a story that shows just how important this gets. Rose was 69 years old, organized and careful in everything she did, and deeply afraid of having a stroke because her older sister had experienced one. Her primary care doctor had her on losartan for blood pressure control. Then, after a short hospital stay for heart-related symptoms, a different doctor changed her medication list and added valsartan. Rose got home, looked at both pill bottles, noticed they were both for blood pressure, and thought to herself that more blood pressure control must be better for her. So she continued taking both medications until her follow-up appointment 6 weeks later. By then, she was feeling completely washed out, dizzy, and strangely weak. She assumed she was just tired, but what was actually happening inside her body was far more serious. She was inadvertently doubling up on the same medication family without understanding what she was doing. Neither her previous doctor nor the hospital doctor had clearly explained that losartan and valsartan are both ARBs, angiotensin receptor blockers, that work through the same system in your body. She thought she was being extra careful about her health when she was actually creating an unnecessary and potentially risky combination. This is the kind of medication error that happens quietly, without drama. Nobody wakes up in the morning and thinks, "Today I'm going to stress my kidneys and push my blood pressure dangerously low." It happens because the medication names sound different from each other, the tablets look completely different, and patients are typically told only the brand name or generic name, never the drug class or family. This brings me to one of the most common side effects that causes genuine panic in patients: swelling. Eleanor was 74 years old, always active and proud that she still took an evening walk after dinner every single day. Her doctor increased her amlodipine dose from 5 to 10 milligrams to get better blood pressure control. About 2 weeks after the increase, Eleanor noticed her socks were leaving marks on her legs. Then her shoes started feeling tight. By evening, her ankles looked noticeably puffier than usual. She stared at them in the bathroom mirror and immediately thought the worst. Was it heart failure? Was it kidney failure? Was something falling apart inside her body? Instead of calling her doctor right away, she did what frightened people often do. She watched and worried. She even cut back on her evening walks because she felt uncertain about what was happening. Over the next month, the swelling got worse. Here's the critical part that nobody had explained to her, and this is what every patient deserves to know from the very beginning. Ankle swelling is one of the most common reasons people struggle with amlodipine, particularly after dose increases. But listen carefully because this needs real nuance. Swelling on amlodipine doesn't automatically mean something catastrophic is happening inside your body, but it absolutely should never be ignored, especially if it's new, getting worse, or occurring alongside shortness of breath, chest discomfort, or rapid weight gain. The reason this side effect creates so much confusion is that it feels genuinely dramatic while often being simple medication related rather than a sign that the medicine is poisoning you. Some people need their dose adjusted, some need a different medication added or substituted, some do beautifully once the dose changes. But what they should never do is silently suffer through it or assume that swelling means this medication is wrong for everybody. Amlodipine helps many people very effectively. The hidden truth is simply that its most visible side effect often shows up in your feet and lower legs, and if no one warns you about this possibility, you can waste weeks or months worrying about completely the wrong explanation. Metoprolol can create a different kind of confusion because its side effects often get blamed on aging. Walter was 76 when he came into my clinic saying something that breaks my heart every single time I hear it. "I think I'm just finally getting old," he said. That's what he believed was happening to him. Walter had been started on metoprolol after episodes of chest pressure and a racing heartbeat. Within just 1 month, he felt tired in the mornings, less motivated in the afternoons, and annoyed that his hands seemed cold even during mild weather. He blamed retirement, blamed his sleep quality, blamed the weather, he blamed everything except the new medication. He genuinely thought he was losing energy because his life circumstances had changed. But what he was actually experiencing is something that can happen on beta blockers like metoprolol. A slower heart rate, lower drive, fatigue, and that strange sensation that your internal engine is simply idling lower than it used to. The harder truth is that metoprolol is not a bad medicine because it does this. Sometimes that slower engine is exactly the cardiac protection that a heart needs. That's precisely why it's so valuable after a heart attack, with certain rhythm problems, in heart failure, and for angina. But patients deserve to know the trade-off up front. Dehydration represents one of the most dangerous situations for people taking these medications, and it's something most patients are never prepared for. Harold was 70 when he caught a stomach virus that most people would describe as just a bug. A day of vomiting, a day of diarrhea, not much appetite, the typical thing. He kept taking his losartan exactly as prescribed because he prided himself on never missing his medication. He thought that was discipline. By day 2, he was weak, dizzy, and afraid to stand up. His wife took his blood pressure and it was far lower than his usual readings. What had happened? The medicine hadn't suddenly turned against him. The body that the medicine was working on had changed dramatically. When you're losing fluid through vomiting or diarrhea, when you're not drinking well, when you're sweating heavily from heat, or when you're empty from illness, the blood pressure medication that normally fits your body perfectly may suddenly hit much harder than intended. This matters especially with drugs like losartan and valsartan, which can interact with dehydration in ways that leave people feeling lightheaded, faint, or frightened about their symptoms. This is one of the most important truths that patients are rarely prepared for ahead of time. The bottle instructions don't explain real life. They don't explain summer heat waves, food poisoning, a flu-like illness, or the week where you can barely keep water down. But your body experiences those things whether the medication label mentions them or not. That's why every single patient on these medications should have what I call the sick day conversation. Not a rule you make up yourself, not random stopping and starting, but an actual plan. What should you do if you're vomiting? What should you do if diarrhea lasts all day? What should you do if you can't eat, can't drink, and feel like your blood pressure is dropping through the floor? Those questions need answers before you get sick, not during it when you can't think clearly. Over-the-counter medicines can quietly sabotage your prescription in ways that surprise even careful patients. Patricia was 73 and genuinely proud of how faithfully she took her blood pressure medicine, same time every morning, same pill organizer, everything recorded in her notebook. Then winter arrived with knee pain from arthritis and a miserable head cold. She started taking an over-the-counter pain reliever for her knee and a cold remedy for congestion. Within 10 days, her blood pressure was higher than usual, her ankles felt different, She thought her prescription had stopped working. It hadn't. She had accidentally introduced new players into the game without realizing it. NSAID pain relievers like ibuprofen or naproxen can interfere with blood pressure control and can be especially problematic alongside medications like losartan or valsartan. Cold products can contain ingredients that raise blood pressure, and because these products are sold casually, people assume they're harmless companions to their prescriptions. They're not always harmless. Potassium becomes a hidden danger specifically when you take losartan or valsartan, and the most innocent-looking culprit is often the salt substitute sitting in your kitchen. Dorothy was 67 and recently advised to cut sodium because of her blood pressure. She took that advice seriously. She stopped salting her food. She bought a salt substitute, marketed as heart-friendly. She felt proud every single time she sprinkled it on vegetables because she believed she was helping both her blood pressure and her heart health. What she didn't know was that many salt substitutes use potassium instead of sodium. While that sounds healthy in theory, it can become a serious problem if you're taking an ARB like losartan or valsartan. Those medications can increase your potassium levels. Add salt substitutes, supplements, certain other medications, dehydration, or kidney issues into the picture, and suddenly you have a recipe for weakness, heart palpitations, muscle symptoms, and in severe cases, dangerous rhythm problems. Never stop these medications suddenly on your own, especially metoprolol. Irene's husband David was 75, sharp, independent, and he hated the feeling of being on what he saw as too many pills. He had been taking metoprolol for years. One week when he felt especially tired, he looked at his bottle and decided to take a break for a few days just to prove he didn't need it anymore. He didn't call his doctor. He didn't taper the dose gradually. He just stopped. On the second day without the medication, his heart began pounding. He felt chest pressure and ended up in the emergency room terrified. That's what patients aren't told often enough. Some blood pressure medicines are not just quiet number lowers. They become part of the rhythm your body has adapted to over time. Remove them abruptly, and the rebound can be serious. Before we finish, I want you to know this. High blood pressure is called silent because it doesn't send you warning signals. You feel fine, you feel normal. That's exactly why these medications protect you. They work in the background, preventing damage that would otherwise silently accumulate. Feeling better is not permission to stop these medications. Blood pressure protection only works when you treat it like a system, not based on how you feel. The moment you start freestyle dosing, you replace actual protection with chaos. Understand why each medicine was chosen for your body. Ask your doctor or pharmacist that one question every patient deserves to ask. What exact job is this medicine doing in my body? That single question changes everything because it turns blind obedience into informed safety. Take care of yourself and protect that heart.